Stridor is an emergency condition and has a characteristic noise in the inspiratory phase of breathing. This occurs when there is an obstruction of the upper airway from the nasopharynx down to the trachea and the main bronchi. The obstruction is usually in the subglottic area. There is commonly a viral illness and it may be preceded usually by the common cold. Measles may also be complicated by laryngotracheobronchitis as LTB. Two important causes of stridor in children are viral croup as LTB and acute epiglottitis. The management of stridor: steroids are most useful when given within 6 hours of onset of symptoms. Cough syrups containing opiates and atropine are contraindicated. Stridor in children. So the causes are viral as laryngotracheobronchitis and bacterial infection, acute epiglottitis, inflammatory obstruction, inhalation of hot fumes, for example in fire outbreaks, angioneurotic edema, retropharyngeal abscess, inhalation of a foreign body, and congenital malformation of the larynx, for example laryngomalacia. The symptoms that are usually presented are low-grade fever, hoarse voice, barking, cough, breathing difficulty, and restlessness. The signs that are usually elicited are stridor, low-grade fever, restless, apprehensive child with when obstruction is severe, hoarse voice, barking, cough, labored breathing, for example suprasternal, supraclavicular, substernal, and intercostal retractions. Also tachypnea, cyanosis and severe obstruction, and reddened throat. Investigations are sputum culture, lateral soft tissue, X-ray of neck, chest X-ray. The main treatment objectives are to avoid aggravation of the obstruction with thick or crusted secretions, to ensure early and timely relief of obstruction, and pharmacological treatment, ensuring good hydration including liberal oral fluids, and ensure maximum rest for the child, establish the airway by intubation or tracheostomy in severe obstruction. Pharmacological treatment for hydration of very sick patients who cannot drink. First line treatment: give dextrosaline IV 5%. For restless and distressed children who require oxygen, if oxygen 1 to 6 liters as required based on oxygen saturation level. For steroid therapy, give dexamethasone oral or IM or IV children 0.6 milligrams per kilogram stat, or budesonide nebulized in children 5 milligrams stat, or prednisolone oral in children 1 to 2 milligrams per kilogram stat, or hydrocortisone IV in children 4 milligrams per kilogram 6 hourly for 2 to 3 days. Steroids are most useful when given within 6 hours of onset of symptoms. Antibiotics should be given in suspected secondary bacterial infection. Cough syrups containing opiates and atropine are contraindicated. In superimposed bacterial infection, first line treatment to give cloxacillin IV children 5 to 12 years, 250 milligrams 6 hourly for 7 days. 1 to 5 years, 1 to 5 milligrams 6 hourly for 7 days, and less than 1 year, 62.5 milligrams 6 hourly for 7 days. Also, you can give gentamicin IV in children 1 to 12 years, 2.5 milligrams per kilogram 8 hourly for 7 days, and less than 1 year, 2.5 milligrams per kilogram 12 hourly for 7 days. And then you give metronidazole IV in children 7.5 milligrams per kilogram 8 hourly for 7 days. Second line treatment, you give cefuroxime IV in children 20 milligrams per kilogram 8 hourly, and metronidazole IV children 7.5 milligrams per kilogram 8 hourly for 7 days. For severe croup, give adrenaline 1:1000 solution, nebulized 2 ml stats, and then repeats hourly if effective. Stridor in adults, the causes are inflammatory obstruction, acute epiglottitis, laryngeal tumor, vocal cord paralysis, retropharyngeal abscess, and inhalation of a foreign body. The symptoms are hoarse voice, breathing difficulty, and restlessness. And the signs that are usually elicited are stridor, labored breathing, tachypnea, cyanosis, and severe obstruction. Investigations are lateral soft tissue, X-ray of neck, chest X-ray. The main treatment objective is to ensure early and timely relief of obstruction. Non-pharmacological treatment: we establish the airway by intubation or tracheostomy in severe obstruction. Pharmacological treatment: the first line treatment for oxygen therapy is oxygen 1 to 6 liters as required based on oxygen saturation level. For steroid therapy, hydrocortisone IV in adults 100 milligrams 6 hourly for 2 to 3 days. For superimposed bacterial infection, first line treatment you give amoxicillin clavulanic acid IV in adults 600 milligrams 8 hourly or 1.2 grams 12 hourly, and metronidazole IV in adults 500 milligrams 8 hourly for 7 days. Second line treatment, he gives cefuroxime IV in adults 750 milligrams 8 hourly and metronidazole IV in adults 500 milligrams 8 hourly for 7 days. So referral criteria: refer cases with severe obstruction and complications in children to a pediatrician or ENT specialist, and also refer all cases of stridor if there is no expertise to intubate or perform tracheostomy to a specialist.